if you notice, she has the second job title. It is Certified Legal Nurse Consultant, and I believe that is her true only occupation and profession. And one of the requirements of that profession is that she be in active practice. So I believe she's maintaining this practice just for that purpose. I don't believe she makes much money off this practice. She probably just makes enough to pay the rent and to pay the employees. Now let me tell you what a certified legal nurse consultant does. They teach doctors and hospitals on how much harm they can get away with and how to cover up the harm. So when doctors and others commit harm, even in a doctor's office setting where there truly is no excuse for harm, the consultant tells them how to get away with the harm in that specific case, including making a determination as to how much the patient is worth. So for some reason, if the patient is not employed at the time, and also if the patient doesn't have any dependents, what they say is that the patient would not have more than $500,000 in economic damages. And so the setup is such that no lawyer is going to take the case unless there is $500,000 in economic damages, and thus the doctors are free to harm the patient at will, and there is no repercussion. And realistically, the medical boards, they never sanction doctors. They only sanction they only go after doctors who in some way go against other doctors, or doctors or others who practice medicine without a license. But they truly do not take any action against doctors. So don't think that if something goes wrong that you can complain to a medical board and they will take your side. That's not going to happen. Realistically, the only thing that you can do is take legal action. And on top of that, if you don't have $500,000 in economic damages, then no lawyer is going to take your case, which really gives these doctors free rein, and they can harm you as much as they want at that point. So what happens is these legal consultants, they tell the doctors that they can all they have to do is go silent and conceal the harm. And even if the patient's condition gets worse, and even if the patient goes for some other procedure like a simple dental anesthesia, or is prescribed some medicine down the road, and the patient is harmed more because someone was hiding the facts earlier, none of that would matter. So the patient really can get sicker and just die, and because the patient doesn't have $500,000 in economic damages. And these issues were addressed in several articles in ProPublica. So in my next video, you'll see what happens when a patient seeks medical care from a nurse practitioner, and it so happens that the patient's ailments are traceable to legal consultants, and this nurse practitioner is also one of them. I believe that she has special training in how to misrepresent facts, because when she misrepresents facts, there is no clues to be found in her voice, expression, and demeanor. There is no lawyer, detective, or psychologist who can do it as good as her. Her skill is equal to a counterintelligence agent. When the rest of us is subject to a polygraph exam, the examiner would know exactly which facts we misrepresent by our physiological response. In her case, the examiner would not know exactly at which point she misrepresents the facts, but the examiner would know that when she misrepresents obvious facts and there is no physiological response, then he would know that she is skilled in misrepresenting facts. So just a bit of advice, and what's the most important thing you need to do to make sure that your doctor's office visits go well is you want to, in a very polite way, you do want to get your records from your doctor in a real-time basis. So if you have an appointment in November, you want to get your records either in December or in January. But the records are where all the action is. So what will happen is, if you go to your appointment in November and you think what the doctor has discussed with you, but in reality the doctor is actually doing something else, and that shows up in the record. The record shows what exactly is on the doctor's mind and what the treatment plan is. So it's not going to match sometimes, what the doctor discussed with you. And also down the road, say 1 year from now, if you find that you were harmed in some way, the doctor can actually go back and alter the records. So you want to get your records in real time. I mean, you do this in every other part of your life. You check your credit report on a regular basis. In similar way, there's nothing wrong with keeping tabs on what your doctor is doing, and they really consider the records to be the official document, and nothing else really matters. Everything you discuss in a doctor's office is meaningless. Just go for the records, and that will keep your doctor honest. And also, you should look at the next video to see kind of what happened when I saw Nurse Bagshaw. So that is a profession where you have the best and brightest in the healthcare field. So you have someone who should be helping in a hospital, in a administrative supervisory position, where you help the lower level employees, take care of patients better. That should be your job. But instead, the person is actually using all their talents for something else which is equal to, say, if you have a driver who hits a pedestrian on the sidewalk, well, you'll have a lawyer who will come across and who will want to defend the driver and make excuses for them. Well, but this job actually goes one step further. It's not just defending them, it's actually helping them hit and run, and it's actually leaving the injured person to get injured more.